Hi, everyone. This is Sean with the MassSupport Network here with the Massachusetts Public Health Report for Friday, January 29th, 2021. Basically what we're going to be talking about this week is how counts are falling across the Commonwealth, but we shouldn't get ahead of ourselves with assuming that the pandemic is over. Last week, it was an estimate of about 89,000 circulating cases. This week, that's dropped by over 10,000 to 78,000. That's still a lot of cases, though, even though we are making great progress. So as of last week, there were 20,000 people under quarantine or monitoring. That is actually gone up to 22,000 this week, with more people on monitoring. However, the big change is come with people under isolation. So as of last week, we had 90,000 people currently isolated. This week, it was only 80,000 people isolated. These, of course, can be different people. A large number of people have completed their isolation terms and returned to their lives. So that is steadily dropping down. Again, still a very large number of people to have in isolation, but steadily moving forward there. In terms of what's driving the pandemic right now, age groups, every age group is experiencing fewer cases than last week. So that's great. Still, the highest group is still people younger than 20. And everything else is more or less staying the ratios are staying more or less the same there as to who's getting infected right now. In terms of hospitalizations, the average age of a new hospitalization has dropped by a year to 70, and the average age of deaths has gone to 80, which is another drop of 1 year there. In terms of our hospital usage, hospitalizations have dropped by nearly 300 since last week, 300 fewer people in hospitals for COVID-19. A slight increase in the ICUs that can be expected to fluctuate that way as some of the more severe cases move to ICUs before the general decrease is felt there. But intubations are also down, almost just over 20 fewer people on ventilators this week. Testing turnaround time has also decreased, which is great, getting the results back faster for people who are waiting for their test results. We had it's not much, but it's still making progress there. That's about 3 hours and change faster to get a test result from the tests taken to reported to DPH. In terms of contact tracing, more or less holding steady, perhaps going a little bit slower this week, at least in terms of outreach to cases. Contact outreach is going a little faster. And hopefully we'll see that. We are, however, going faster in the actual speed of things. You can see last week, just under 50% of cases were reached within 1 day. This week, it's 72%, so that is great. So definitely ramping up there, even though we're actually making contact with fewer people. And as the numbers drop, that may actually have something to do with just fewer, just not able to actually make contact with some people. In terms of looking at the state as a whole, last week, incidence rate was about 75 cases per 100,000 people over the last 2 weeks. Right now, it's dropped down to 59.4. That's a huge decrease. Still a ways to go there, but every county has seen reductions. Essex County alone saw 30 fewer cases per 100,000 people. A lot of drop-offs just across the board here. So that is great how things are declining. But again, not to get ahead of ourselves. In terms of percent positivity, that is also on pretty steady decline there, about 4.4 when you include higher education testing, 6.3% of the general state overall. Looking at the 7-day averages for the state, I extended this chart backwards to show the last time we were about at this point. Now, usually the last day or two of this is a little lower than it actually is due to incomplete data, but we are roughly around the point where we were about at Thanksgiving, which is great, just to show how much we've recovered from the December and early January waves here. This is, of course, the dip around Christmas Day, when there was no reporting for one day, and that threw off the numbers. You can kind of just ignore that little dip there. We're basically kept on steady there. But as you can see, we've come down after a lengthy plateau there. Looking county by county, the higher transmission counties are in a pretty uniform decline here, although something should be called to Middlesex County, which has come down the most there, with just 2 weeks ago and change, nearly 12,000 new cases per day, dropping down to about 700. That's a massive decline over there. But all of these counties, Worcester as well, doing a very, very sharp decline over the last couple of days, downwards. A couple of them less so. Barnstable has held fairly steady over the last 2 weeks, in just around 100 cases per day. Again, still definitely declined from where things stood earlier in the month, but not as fast as some of the counties with higher case counts. Looking at the areas with lower transmission, just very steady decline in Hampshire County and Berkshire County. The islands and Franklin, which are always going to be the smallest, still potentially a little bit of decline there from earlier, when some of them were closer to 20 and now closer to 10. It's still noticeable, but we're going to see much fewer at this level, where one bad day or one outbreak event can throw off the numbers for something that small. All right, and one last thought as we go into the weekend. Just the reopening in Boston. Now, just remember, gatherings still limited to 10 people indoors or 25 outdoors. Number of businesses can reopen, but remember, please stay safe. Don't, because case counts are falling, this is not the time to go out and take additional risks, as we're making progress, but it would be very easy to undo all of that with just a couple super spreading events, especially with these new variants out there. So say just follow the same rules you've always been following. Vaccines are coming, they're out there. Phase 2 of the vaccine rollout starts on Monday. And but remember, even if you've been vaccinated, it does take a couple weeks before you really get that full protection. And for more from the MassSupport Network, you can find us on our website or on social media. And remember, wear your mask, wash your hands, and we'll be here if you need us. Stay safe.